Did you realize that one of nature's most healing fruits can be harmful if eaten incorrectly? Papaya is a great tropical superfood that contains digestive enzymes, strong antioxidants, and critical vitamins that can improve gut health and immunity. However, there are 6 essential blunders that could convert this beneficial fruit into a health risk. Some are so common that you might be making errors right now, while others may be life-threatening in particular situations. I've been studying nutritional biochemistry for over a decade, and papaya wonderfully exemplifies how the dose becomes the poison when ingested right. It's quite useful, but when taken incorrectly, it can create major complications. Hit the like button if you want to learn how to use papaya's therapeutic properties responsibly. Please let me know in the comments if you eat papaya on a regular basis and have ever suffered any strange symptoms as a result. Now let's look at the most common papaya mistakes individuals make. Mistake number 1 may surprise you: wasting a nutritious gold mine. The first mistake includes papaya seeds, which 99% of people toss away. When you cut open a papaya and discard the black seeds, you are essentially throwing away one of nature's most powerful natural medicines. A study published in Fatal Chemistry Journal discovered that benzoisothiocyanate in papaya seeds is helpful against parasites. According to the Journal of Food Science, these chemicals have broad-spectrum antibacterial activity against E. coli, Salmonella, and Staphylococcus aureus. Papaya seeds include high levels of papain enzyme, which aids in protein digestion, oleic and palmitic acids, which have anti-inflammatory qualities, flavonoids and phenolic compounds, which are potent antioxidants, and dietary fiber, which promotes good bowel motions. For generations, traditional medicine practitioners have utilized papaya seeds to treat digestive ailments, liver difficulties, and parasite infections. Papaya seeds can be eaten either fresh or dry. Chew 5 to 6 fresh seeds after each meal to aid digestion. Let them dry for 2 to 3 days. Then grind into a peppery spice. Add half a teaspoon to morning smoothies or sprinkle ground seeds over salad. However, research reveals that papaya seed extracts can be dangerous if ingested in high quantities. Never consume more than 1 teaspoon of fresh seeds or half a teaspoon of powdered seeds daily. Begin with 2 or 3 seeds and progressively increase. Pregnant women should avoid papaya seeds entirely, and those with bleeding disorders or taking anticoagulants should exercise extreme caution. The second mistake is the time trap. Eating unripe papaya has unusually high levels of popping enzyme, which can be 10 to 15 times more concentrated than ripe fruit. When ingested in excessive numbers, this concentrated enzyme can literally begin eating your stomach lining, resulting in extreme stomach irritation, acute heartburn, nausea, vomiting, diarrhea, and abdominal cramping. For pregnant women, this is quite risky. The increased papain concentration might cause uterine contractions, especially in the first trimester. Historical records show that unripe papayas were used as an abortifacient. According to studies, excessive doses during pregnancy might cause premature contractions, miscarriage, cervical dilatation, and preterm labor. Unripe papaya is safely used in several Asian cuisines, such as tam, because it is combined with buffering items that are ingested in little doses. Reduce the concentration of enzymes during preparation. To avoid making this error, select properly ripe papaya with predominantly yellow peel. There is a slight give when pressed at the stem. Unripe fruit can ripen at room temperature for 3 to 7 days, thanks to its sweet tropical scent, brilliant orange and yellow flesh, and black or dark gray seeds. To expedite the process, place it in a paper bag with a banana. Next error. Number 3. The hidden hazard of pharmaceutical interactions. If you use certain prescriptions on a regular basis, this error could have fatal consequences. Papaya includes vitamin K, which aids in blood clotting. If you take anticoagulants like warfarin, Eating a lot of papaya can interfere with their effectiveness, perhaps leading to a stroke, pulmonary embolism, or heart attack. Proteolytic enzymes, such as papaya, can increase the potency of anti-inflammatory medications, posing a risk to persons with MS. Anti-inflammatory and corticosteroid medications are prescribed for AIDS. Papayas have modest laxative effects that might speed up intestinal transit, limiting oral medication absorption, which is especially problematic for time-release pharmaceuticals and treatments with small therapeutic window. People on cardiovascular, diabetic, or immunosuppressive medications should take extra caution. If you use drugs on a daily basis, check with your doctor before adding papaya to your diet. Inquire about scheduling medications based on papaya consumption. Consider more frequent blood work testing, and never change drugs without supervision. To be safe, limit papaya consumption to less than 1 cup per week. Take your prescriptions at least 2 hours before or after eating papaya, keep a food diary, and keep an eye out for changes in drug effectiveness. The fourth error: the more is better illusion, gluttony, and papaya. If something is healthy, we assume more must be better. However, this can backfire. Papaya is unusually high in dietary fiber. Too much, too soon, at 2.5 grams per cup, results in severe diarrhea, abdominal discomfort, excessive gas, and nausea. The proteolytic enzymes may overstimulate the stomach. This can cause gastrointestinal irritation, increased acid production, heartburn, and stomach lining erosion. In severe situations, excessive papaya consumption can produce keratin from too much beta-carotene, resulting in yellowing of the hands and feet, orange skin, hue, and yellowing of the eye whites, which is totally reversible and not hazardous. It can be frightening if unexpected. A single diet cannot cure diseases or replace medical treatment. Although papaya has numerous benefits, it cannot cure cancer, replace diabetes drugs, treat chronic inflammation, or act as a miracle weight loss cure. Evidence-based guidelines indicate a maximum of 1 cup, 140 grams per day, which provides 88 milligrams of vitamin C, 98% of daily needs. 1,532 international units, 31% of your daily vitamin A needs, and 2.5 grams of fiber. It is preferable to consume papaya 4 to 5 times per week rather than every day to allow digestive processing, limit keratin risk, and prevent enzyme tolerance buildup.